Thanks, Leslie. I just wanted to mention, if you did not get one of these, I had sent these to the office. There's 100 of these here. They go through all the data on 12 to 18, 18 to 26, 26 to 34, and every morbidity and mortality and chronic diseases that we're talking about today. And I want to thank Claire and Trina for getting this together. I've had deep in my heart and soul, I've been dreaming about a conference like this on young adults for years. And it's great that it happened. But I had another dream. I like children's books. And as I was thinking about everything that everybody was saying here today, I suddenly had this image of this room being Hogwarts. And I'm being Harry Potter with a magic wand. And there's a cauldron here. And in this cauldron, we throw cars, bicycles, guns. We throw drugs, alcohol. We throw cell phones, of which 109 messages are coming through, 80 in the car, or on the bicycle. We take young adult minds who have perhaps emotions over cognitive issues, and then to top it all, we take 25% of their insurance cards of the country, and we throw it in there to destroy. Now, what are we going to end up with out of that potion? I think we saw that in a lot of data, and some of it that I'm going to present today. Accidents, suicides, homicides, poor academic outcomes, STIs, mental illness, anxiety, depression, unintended pregnancies, rapes, violence. And then if they get injured, they're not going to have the insurance or enough comprehensive insurance to cover this. Now, one thing about physical health that is a little bit of a pet peeve of mine, because I am not a doctor or a doc in a box. Physical health is not in a box. It includes mental health, community, and that's a broad term for community. It includes where is this person developmentally. It includes health promotion and wellness services. And if I were to really have a globe, the other part of this in 3 dimensions would be all the diversity issues we've talked about, would be ethnicity, would be socioeconomic status, would be LGBT issues. You have to throw all of that together to really talk about physical health. But I will try to do this. And this is what I call the perfect storm of emerging young adults. We've talked about their health risks, the highest morbidities, and I'll go through some of those as quickly as I can. But on top of that, when it's been studied, they have the least perception of great risk of those issues. Less perception of risk than adolescents. They also have the least access and insurance in the country. Now, you throw those 3 things together, and that's a problem. This is one of the best examples I put together on emerging young adults that's in that monograph. The blue there is what happened to the prevalence. The blue there is prevalence, which is higher in binge drinking in young adults by far. This happens to be United States and California. It doesn't matter. This happens to be perceptions of great risk, the least in 18 to 25 in both states. This is access needing but not receiving treatment. Goes along with not having insurance, highest in 18 to 25. Well, if we look at the physical causes of the worst outcome, which is mortality, motor vehicle accidents are up there. Now, compared to adolescents, the types of diseases and injuries are the same, but young adults have about 3 times the number. Then we look at neoplasias and heart disease, which are 4 and 5 in both groups, HIV, cerebral vascular disease, pregnancy, diabetes, and other potential problems, about 40%. The spectrum of which we're covering, injuries, reproductive care, obesity, eating disorder, chronic diseases, as I said, cancer and cardiac disease are 4 and 5. Substance abuse and the physical consequences, and mental illness, which is associated with many physical consequences. This is from NCHA college data. They indicate what have you had in the past year. I put in yellow kind of physical related pains. That was my task. Back pain, allergies, sinus, strep throat, asthma, ear infections, carpal tunnel fractures, blood pressure, cholesterol, substance abuse, chronic fatigue, warts, a lot of STIs. What else? Tuberculosis. And I put on another list, what of these are health problems with the potential onset in young adulthood, or that might really be helpful with early intervention. And you can see those there that range from carpal tunnel to high blood pressure, cholesterol, and we'll talk a little bit more about those later. Just in terms of their chronic diseases, I put in yellow the ones that I thought had particular maybe frequency or rise in frequency during young adulthood: thyroid disorders, diabetes, hypertension, hyperlipidemia, again, malignancies. There's a few listed there that have increased prevalences in young adults, and eating disorders. Now, we talked a bit about motor vehicle accidents, but one thing is amazing to me when you look at this enormous spike right at the beginning of early adulthood. And then it stays that way, as we were talking just a few minutes ago, for a few years and then goes down. Well, what can we do to stop that? How can we prevent that? Because that is just such an enormous spike with a lot of implications. Obviously, some of it's related to this, which is drinking under the influence. The highest prevalence is in, you all know it, you could kind of sing it, young adulthood. And this is an amazing thing. The last one I wanted to mention about injuries was the consequence in this country. This is 2005. This is medical costs and work loss costs. If you look at that, and you got to remember that there's one more year included in 26 to 34. That's 9 years versus 8 years in 18 to 25. So you'd have to correct that by 8/9. It's almost $7 billion in this country spent due to non-fatal motor vehicle accidents, much more than adolescents, much more than young adults 26 to 34. Another pet peeve of mine, unintentional injuries. This is on college campuses, but it's all over the country. Bicycles. 70% never wear bike helmets. You come to our campus, it's 100%. I won't say it's 100%. We found somebody. One of our support persons found an individual out there, hidden away in a tree with a bicycle helmet. They grabbed him, brought him to my office. We got him a gift certificate to the bookstore. Very excited. Intentional injury is another issue. Amazing, 13% of young adult college males got in a physical fight last year. A lot of that related to alcohol. You talk about maybe subgroups. There's another subgroup besides college, non-college. It's college, non-Greek, college, Greek. If you look at the biggest increase in either physical fights or in alcohol binge drinking, it is significantly higher. We looked at it on our campus. It's been looked at nationwide. It's related to being involved with the Greeks. Obviously, this can also lead to intentional injuries to rape. One thing I wanted to point out that was talked about a little before on alcohol and other drugs, college, non-college. Monitoring the Future does a nice job of separating out college from non-college. The others are non-college students. The yellow means they're 20% higher than the other group. So this is lifetime use in 2011. In almost every group, they were 20% higher in non-college students. However, look at this 2008 on amphetamines. This is predominantly non-prescription to the person, Adderall and Ritalin. In 2008, it was twice as high in non-college students. In 2011, it's about the same. If you look at the last annual use, it was 20% higher in 2008 in non-college students. Now it's 20% higher in college students. And if you look in the last 30 days, it used to be about equal. Now it's double in college students. If I would say there's one trend that's trading dramatically in the last 3 years in colleges, non-colleges, it's amphetamine use. Binge drinking we talked about, but this is a real high-risk group here. There's 5% of males that drink over 5-6 drinks at one time. This is almost every day or every other day. This is the past 2 weeks. We went over the consequences. There are a lot of physical consequences, including the question they've recently asked, which is suicide, where almost 2% said they thought about it. And this is an interesting one. What are our students taking that is a prescription that's not prescribed to them? 3% are taking antidepressants from friends and neighbors or family. 1% erectile dysfunction drugs, almost 9% painkillers, 4% sedatives, and almost 7% stimulants. Well, we'll move into some of these STIs and other physical things. Chlamydia, we talked about that it was as highest in emerging young adults. And there are racial differences. Blacks are the highest for chlamydia, gonorrhea. A significant difference here. If you look at syphilis, which is rising again as a problem, and this is most significant in men having sex with men. HIV is highest in our emerging young adults. This is very interesting. This is improvements in mortality in cancer. So a lower on the scale is worse. The higher you are, the better your improvement. So there's better improvement in pediatric and adolescents, goes down in emerging young adults, they do worse with cancer, and then it goes up. Not something you would normally think about. Interesting, look at these two curves. This is insurance overlaid on mortality, the same curve. This is, are you involved in a national trial? The same curve. So we have a population of emerging young adults with cancer that seem to get uninsured, lost in the system, and lost in trials. The AYA came out with, through the NIH and NCI, some recommendations. These recommendations can actually apply to a lot of things we're talking about today, where you're identifying characteristics, improving awareness and prevention and quality of care, create tools to study X, ensure excellence in service delivery, strengthen and promote and advocate and support the patients. These could apply to anything. And just remember, there are a few there that might be preventable in this age group, melanoma in particular, testicular I'm not as sure about, and thyroid certainly increases in prevalence. Physical disabilities. There is a 10% or so physical disability, mental disability or motion disability nationwide and in California, a bit higher in 25 to 34. Overweight. Now, this is not highest in emerging young adults, but there's this big jump up. This is a time that we need to intervene to prevent this from continuing. Over time, this curve has gotten worse. The prevalence has gotten higher. Fruits and vegetables. None of these populations are doing their 5 fruits and vegetables a day. I was asked to throw this in. I'm throwing this in. But you will notice there is one interesting group in particular, Asian women. They have half the use of fruits and vegetables than any other group, 1 a day. What about those of physical activity? Our group finally scores better here. They have a percent that meet recommended. They do a little bit better than the older group in terms of meeting. Still, 40% don't meet the recommended activity. Diagnosed with diabetes, it rises, and when we start to go from emerging young adults, there's a huge jump that is a huge opportunity for intervention and prevention. This was from Kaiser data in Northern California, another resource that I went to, and again, you could see the huge jump into the red of young adults versus emerging young adults. We need to do something between those two lines. Here's an area that is interesting in red. That's 26 to 34. 1% of that group was found to have lab results indicating overt diabetes, but they didn't know about it. So that is something to think about in the ages starting in 26. It's smaller in the younger kids. High cholesterol, the same thing. It's time to intervene. There's this huge jump from emerging young adults to young adults. And same with hypertension, another opportunity to intervene. So looking at college students, this is college students, here's an interesting point. I like alcohol prevention. We need to do alcohol prevention. But if you ask students why they don't do in school, it is not in their top 10. It's number 15 or 16. But number 6 nationwide is computer use. So what do? Our resolution, give them the fastest T-lines, give them free computers, and that's how we're going to prevent their overuse of computers. But I guess we got to go the same way as sort of safe sex. They're going to use the computers. We have to find the safest ways to do it. Condoms don't work on iPhones, So we have to find a different intervention. But actually, at our campus, internet games comes out about 15%, and with males, it's almost 18 to 20% that state they do worse in their academics. In insurance, there's a lot of talk out here about these kids getting on their parents' insurance. Well, when they were able to do that, the rates went from 28% down to 24% in January 11. Between January 11 and January 12, they actually went up about 0.5%. It's been a straight line. So this has not solved the problem. Perhaps it'll get better, but as of now, it's not solved this problem. So there are some guidelines to screening. I have in that other handout, Claire Brendis and Elizabeth Ozer at UCSF did a great job of doing this chart that summarizes all of the medical societies and what they recommend, but it's all over the map. And we have to do a better job of figuring out what that is. I have to finish, because I love helicopter parents. They're, you know, and involved parents are great. And Larry, I always end this, but I'm not today. I always finish my helicopter stuff with your material in terms of parenting, and parents love it, so thank you. But the helicopter parents, I think, is an issue when they're over-helicoptering in terms of increasing anxiety and confidence deficits. And I have to tell you about one of them. I don't know if anybody knows this one. Have you met this one? This one is the Black Hawk Down helicopter parents. He goes not to the VPs, not to me. He goes straight to the president of the university to solve the problem. He's bombing the president. And, you know, and this is, you know, it's not just in college, you know. I don't have my homework, Miss Flynn. My parents forgot to do it. So I'm going to end repeating that, you know, young adults need, they often don't have identified healthcare providers or systems. They're frequent users of social networking, non-traditional care. The health guidelines are not as well defined, which gives us many opportunities. We've got to put ACA and prevention together. We got to get more comprehensive, not just catastrophic insurance to cover all the things that are up here. They need to be evidence-based screening. Electronic records may play a role, and we need to use the technology as best, as safe, as reasonable as we can for mobile medical apps, web-based interventions, and Skype-like interventions that are protected. The website for that handout here, if you want the PDF, is at www.usc.edu/thenewAdolescence, And if you're interested in something that we did, that the Society for Adolescent Medicine is now distributing, it's in pediatric offices and campuses. It's sort of like a primer for parents, for their kids who are entering young adulthood. Gives them quick guidelines. So that might be helpful for them. So thank you.
Thank you very much, Dr. Neinstein. Next, we will have Dr. Tamara Coyne-Beasley, who is also a professor of pediatric and internal medicine at the University of North Carolina, Chapel Hill, and she will give us some information on young adults facing particular challenges.